Yeah, and so the last video I showed you how Sheila, we showed her before and after x-rays of the joint space in both knees. Definitely showing more cartilage regeneration in the medial knees. But for some reason, the left knee's no pain, right?
Correct.
But the right knee still has some lingering pain, and I found out why. Even though we showed that she has more cartilage growth in the medial knee, the problem is she had a procedure here, see that scar, because she had osteochondritis dissecans where the kneecap was grinding, patellofemoral grinding syndrome, and that wore out the knee, so they did a procedure here. But as you can see, the left knee, there is some space in its subpatellar joint right there. See that black in there? Okay. But because she had patellofemoral tracking syndrome in the other knee, the right one, you can see the right knee doesn't have that space. It's bone on bone, so it's still grinding. So that's why you still have the knee pain. So now we got to do is we have to put the umbilical cord stem cell, maybe some exosome. Feel that clicking there?
Yes.
That grinding? Here's another test here, patellar grinding test. Go ahead and straighten that, contract that. Okay, relax. Contract. Contract, up. Straighten your knee, yeah. So, relax. And because the groove, in the patellar groove, it's not tracking right, it's grinding. That's why you still have the pain on the outside here. So we have to put, see that space? Probably the cells in there. And that'll help regenerate, the subpatellar joint right there. So if we look here, the upper part of the scar with the procedure, about 87 degrees. If we go down, 87.3, so this 87.8, a lot of grinding right in here. See, it's bone on bone. But the entry point, we'd slide it right under patella, right there. And that solves the mystery of why, like we showed last time, why is it you're getting more space regeneration here? Because we put the stem cells on the sides, right? Well, we got to put your next round underneath the kneecap, and that'll help rebuild the subpatellar space so it doesn't cause that grinding pain, because we want to have it some space just like underneath the left. You see the right, there's no space here, because you had that procedure and it just wore out. Okay, I think we solved the mystery, because you had last year adipose derived stem cells.
No, I did that almost 4 years ago.
And that did nothing.
Did nothing. Absolutely nothing.
The umbilical cord stem cells we used, plus the exosomes, did get some regenerative space back. We saw there. This knee's great. We just need to get it underneath the kneecap there, so you get more smoother tracking, and that'll solve the mystery. Okay, that's how we do it. We don't give up on patients. We get to the bottom of things. Make sure we diagnose the cause of knee pain, not just bandage up with injections or knee replacements or failed stem cell therapy, because A, they're not getting young cells. Umbilical cord cells are days are old. The exosomes, we use that because they're smaller and you can get a lot of signaling pathways, messenger RNA to signal the bone on bone part of the knee to repair, and the laser to stimulate the cells in the exosomes to signal complete repair. We just got to get enough underneath the kneecap now to complete that. And Shlee, I don't know if you want to chime in on how you've been taking care of here.
I've been doing everything I'm supposed to do. I've been taking the alkaline water. I do the red light stimulator, and even though I was told to do it at least an hour, I do it anywhere from 2 to 4 hours every single day, and I've never missed a day since day one.
Okay, great.
And trying to ease back into exercise, but listening to my body, which I think is very important. If it hurts, stop.
Yeah.
Listen to what your body has to say. Work with your body, not against your body.
And because this is your third stem cell / exosomes. See, exosomes are not cells, so
Right, they're different.
they're biologics. We're just going to do this one on the house because I feel this should have been, the cell should have been put in here as well. So we're just going to do the third one pro bono, because again, although we did do our job regenerating the meniscus space, you want the subpatellar joint to track properly, okay?
And what I'd like to tell everybody is the doctor who never gives up. He always is there fighting for me and always fighting for every patient and always wants the best for us, which I don't find in many doctors these days.
Okay, all right. And we'll, of course, after we do the procedure for the subpatellar joint, we will do a follow-up interview to see how she's progressing. And a few months later, hopefully we'll show the regeneration of that space underneath the kneecap. You know, so it doesn't grind anymore, and you can go back to what activities you want to go back to?
I want to go back to my full exercise. I'm used to working out almost 2 hours every single day. I literally lift 12 pounds of ankle weights. I do anywhere from 60 to 75 minutes a day on either an elliptical or a bike. Do free weights, do core. I'm a person who loves to exercise, and I do it 7 days a
That's
week.
why she still looks so young right there. I mean, she's in better shape.
And I'm almost 70.
90% of her friends hate her because she has all her hair and all her muscles. Let's just keep those, okay? We'll do a follow-up later. Thanks for watching.